I am Dr. Kiran Shah, the colon rectal surgeon practicing in South Bombay for last 28 years. I am honorary colon rectal surgeon attached to Apollo Spectra Hospital, Tardeo, Mumbai. Well, the symptoms of bile is initially just as the stage increases, you may get, they feel a spot of blood while defecation. And usually when they wash, they think that there is the blood in the hand or the blood at the side of the toilet. So it's an early stage. One should not get panicked. Just take a local medical treatment and you'll be fine. Laxatives, antiamoebic, deworm, and you'll be fine. Sometimes as the disease advances, the frequency of bleeding, which is a common symptom of bile, initially it will take one day. Then after a year, you never had a bleeding. Then the next episode can occur after a year or after 6 months. And as the time goes by, as the disease increases, the duration keeps on decreasing. The first bleeding, second bleeding may be 1 year. Now the third bleeding may be within 6 months. The fourth bleeding may be within 3 months. And afterwards, every month, then every 15 days, then every day, practically it goes. So all this, and then it should be treated. If it is a grade 1, grade 2, early, it can be managed with conservatively simple way. Like options are there available, which you can do it a bending. You can do bending is just one particular rubber band is applied to the bile mass so that your bleeding stops and the disease regresses. You can also inject that particular area where it's bleeding. So coagulant agent which we are using it so that ultimately the vas gets obstructed and your bleeding stops. So you're devoid of the symptom. Main thing is that even of infrared coagulation can be also be used the same way. They are just OPD procedure. You don't have to stay anything. You just come within about an hour or two. It has been done, and you're back home and back to your work. But if it becomes advanced one, then you have to go. Advanced symptom will be there's a much more bleeding will be more, and then you may find one day the bile mass has come out, and now it is not going in and that bile is obstructed and now it has become thrombosed, then it can get inflamed, it can get infected, necrotic, gangrenous. Such hemorrhoids should not be taken easily. They need to be tackled and that to be tackled by surgical management, which is very, very important. Otherwise, you're going to pay the heavy price for it.